The Delta variant, first identified in India, has now spread to nearly every state in the U.S. The CDC says it accounts for about 1 in every 5 new COVID-19 infections. And some health experts are warning about dense regional outbreaks of this more contagious strain of COVID-19 in the fall. Amid these growing concerns, the World Health Organization is urging everyone, even the fully vaccinated, to keep wearing masks. So Dr. Dyan Hes is with us to discuss. She's the founder of Gramercy Pediatrics in New York City. So glad you are here, doctor, because I think, this is the sort of stuff that gets people really confused. Then they start to kind of decide to do their own thing because they're hearing all sorts of different directives. So yesterday, Los Angeles County issued a similar recommendation saying that all residents should wear a mask indoors when in public spaces. Should other counties or states follow their lead? Should you, consider what the vaccination rate is in the place where you live and then determine whether or not those are good recommendations? What's your take on this?
I think exactly what you said. I think you have to look at the local rate of where you live, your county, your state. I think you have to see if there's actually Delta variant spreading in your area. I know that in New York City, the rates of COVID are actually way down. So I don't feel right now as a pediatrician that we're seeing an outbreak of the Delta variant. But, this is a very fluid, very changing landscape. And, I think that's what frustrates people the most. I'm all for mask wearing. I'm not for lockdowns. So I am fine that if we can keep the economy open and wear masks indoors, if that's what my county tells me to do, I'm going to do it because I need to work. What I'm against is locking down, because that proved to us, California had massive lockdowns and they had the highest spread of COVID. So, I just think that it's very frustrating as doctors and as, citizens in this country and, people who live here that we wake up and every day the rules change.
It's so true. So in regards to these variants, one of the things that I have heard sort of over and over again over the past year or so is that something that we're not doing very well in this country is tracking the variants, doing like the DNA sequencing or whatever to determine just what variants are out there. And there are certain federal laws preventing labs from sharing exactly which variant a person who tests positive for COVID-19 actually has. How does that impact the tracking of the virus and its spread?
Well, it's really poor because the tests are so new that they're not FDA approved. So technically, the laboratories are not allowed to share that with the doctors. So I won't know if I had a patient who came from abroad and tested positive for the Delta variant. I send a PCR test. Nobody calls me and tells me that they have the Delta variant. So I can't even say, listen, your family has a Delta variant. You might want to really be careful and we could do better contact tracing. We don't even have that ability as physicians or nurses. But I have to tell you, I've said this from the beginning, the reporting of COVID has been way underestimated. I have reported hundreds of cases of COVID that were just done on rapid positive, same like schools do. And I know because my own family, we had COVID and some of us were tested rapid, some with PCR. And I know with the PCRs, the city contacted us and there was contact tracing. But for my kids who did a rapid test that were positive, my daughter, no one contacted us. There was no contact tracing. So I feel that the numbers of people who had COVID, who went to urgent care or doctor's offices and had the rapid test done, those weren't even counted in the millions that we say are positive. So I just feel like we're so behind the 8 ball as far as tracing and the DNA, forget about it. I think we just grossly underestimated how many COVID cases are around.
So as we know, the vaccine is now available for children 12 and over. I know there are probably a lot of parents that are sort of going back and forth about whether or not they want their kid vaccinated. And they're thinking, look, we have time. They're out of school, maybe they're in camp, but maybe they're not even in camp. So we don't have to worry about it until school is imminent. Just how long do parents have to wait before they make the decision whether or not to vaccinate their child?
Well, first of all, they should find out if their school requires the vaccine. If they're 12 and up, definitely some of the private schools in New York are requiring the vaccine to come back next year. So you have to remember that it's 2 vaccinations, 21 days apart, and then it takes 2 weeks till you're fully vaccinated. So you have to check if your school is going to require it. The second thing is you have to think about the calculated risk for your child. Personally, if your child is obese, 100% get the vaccine. We know that that is the number one risk factor in getting COVID. If your child has diabetes, that might be an issue, an immune problem. So these are the things that you really have to consider if your child's high risk. I think if your child is lower risk, you have that time to wait and decide. You might just send your child, make sure your child wears a mask all the time. But if your child is unvaccinated, they should be wearing a mask indoors all the time. There is no reason not to be wearing a mask if your child is indoors and not vaccinated. That's for sure, especially with the new spread of the Delta virus.
That's good. That is good news to know, or good reminder. So, throughout the last year and plus, we have talked a lot about kind of the other health impacts of this pandemic. 2 U.S. hospitals, one in Louisiana, one in Washington, D.C., both reported that hospitalization rates of kids with newly diagnosed cases of type 2 diabetes doubled during the pandemic. Now, I'm not necessarily saying there's a connection, but it's interesting. Right. Can you explain, how this could be a microcosm of what may actually be happening around the country? I mean, when I read that, I just thought to myself, man, it was a running joke how badly everyone was eating in the beginning of the pandemic and how little they were moving. So, of course, it may very well trickle down to our children as well,
Well, this is my passion. I'm actually reviewing an article now for Childhood Obesity Journal about this. The obesity rates skyrocketed during COVID. I have patients who are 10, 11, 12 who gained 30, 40, 50 pounds in a year. That's like gaining a whole other child. Think about if we want to go on a diet and we want to lose 5 pounds. That takes a long time. It is very hard to lose that amount of weight, and this is what has made diabetes skyrocket. Now, it goes from 0.3% to 0.6%, so that doesn't sound like a lot, but that is doubled, and that is because kids were eating nonstop because they're home from boredom. They didn't have access to healthy school breakfast and school lunch. Most of the kids would get, remember, if you are eligible for free breakfast and free lunch, you get a lot of your nutrition in the schools. Head Starts were closed. I mean, kids did not move. Parks were closed. You couldn't ride a scooter out on the street. We begged in New York for them to open the parks. I made my kids get outside every single day, but not everybody's like that, and not everybody has the capability. And if you had a high-risk family member, you were terrified to go outside. So I can tell you, I don't have a particularly inner city population. My patients are more middle class and upper class. But I have to tell you that the amount of weight gain, it's the trajectory is just off the charts. And I'm talking, I have 3-year-olds who gain 15 pounds in a year. And this is what causes type 2 diabetes.
Okay. I feel like we definitely will have to pick this particular conversation up at another time, all on its own. Dr. Dyan Hes, it's always a pleasure talking to you.
Thank you.